first?
Obtain the order.
Okay, and then
Find the site.
YouTube CFS
we're
one.
missing one thing. What else? Allergies. How many people have had patients that are allergic to tape or Tegaderm? What do we do then?
Use
We can't use Tegaderm, what do we do?
right. Sometimes
Pressure.
tape-
No. What did you say?
Right.
Do you put paper tape over the site?
No.
No. What do we put over the site?
Plastic.
No. Gauze. Sterile gauze. So not the gauze that's in those big long packs, but actually individually wrapped sterile gauze. Okay, maybe my hands aren't as small as I thought. I always recommend doing a size small for gloves so that you don't run into your finger not being able to feel things. Okay, the tighter it is, the more you're gonna feel. But don't go like crazy. All right, make sure there's no air. What different things are you gonna do if you need to get blood from an IV?
You have empty syringes,
Okay, do you put the tubing on there?
vials.
No, you use the syringes before you attach the tubing, right? Okay. Elisa, can we use the ChloraPrep on the arms or does it ruin the skin? You can use it. Okay. How long are you supposed to scrub with ChloraPrep? 15 seconds.
That's a long time.
It is a long time, yes. Yes, it is not like betadine where you do circles. You scrub back and forth, okay? How do you check to make sure your IV is working? The needle. Any ideas? Never take the top off, okay? You don't want to expose, so you just pop it a little bit so that you can rotate this pink part. So you barely need to move it to rotate it. If it rotates, then it's not adhered, okay? But you don't want to remove this until you're ready to stick, so you don't contaminate it. Do you ever stick tape on the side of the bed?
No.
No. Do you ever stick the Tegaderm on the table or anything?
Uniform.
No. You never expose surfaces until you're ready to place it on the patient. Okay, so you wait till the very end with that. So sometimes you'll see people will tear it a little bit and then stick it on things. Don't do that. And then what's the gauze for?
Pressure.
Not if you mess up. It's so it's not messy, okay? All right, so everyone's gonna have different techniques. I want you to find what's comfortable for you. The steps are going to be the same. How you do the steps, as long as your aseptic technique is there, it's okay, all right? I don't want you guys to get caught up on, oh, I didn't set this there or set that there. Be comfortable, all right? Testing is a lot easier when you're not stressed. All right, so I got my lovely tourniquet. I verified everything already. Washed my hands before. You also want to make sure that this little cap is unscrewed, but don't remove it, okay? And then do you have to shake this once you squeeze it? No, right? The shaking doesn't do anything. It doesn't make it faster. It's the scrubbing that makes it actually come out. I'm gonna fake 15 seconds because that takes a long time. Don't do this, okay? That just makes the air and then you contaminate it all over again.
Or blow on.
Or blow on it, yeah, I've had that a lot too. All right,
Usually you see
so,
them doing this. Nope, no waving.
yep, no waving, no nothing. So here, if you have a patient that you can see there's lots of little marks, don't use that area, okay? Because then there's probably a lot of scar tissue in the vein, around the vein. But there's a good one right here, and there's one up here. And that's just visual. I haven't even felt anything yet. All right, so then you take your stuff off. You pull down at the base of the vein, and then you're gonna actually poke above your thumb, okay? You go in at a downward angle. When you feel the pop, then you can lower it a little and advance. You can use your thumb, you can use your forefinger, again, whatever makes it easier for you. And then at this point, when the needle is still barely in there, is my cue to take the tourniquet off, okay? Even if you're drawing blood from an IV, you can still take the tourniquet off and let the blood pressure actually help you draw the blood, okay? So then you have this cap ready, you pull this out, you have this right here, and then you use both hands to screw it in there. Now, one thing that I have done is when you have your gauze, at the point before you connect, you can set this under here, and then if it leaks at all, it'll collect on there, and then it'll be a little less messy, okay? So here you want to advance a little blood, or saline, and then pull back to get your blood return, and then at least 5 cc's, because that will show you, it'll start bubbling if there's any sort of infiltration, okay? Do your clamp, make sure there's no gauze underneath the dressing. At this point, you can use this same finger to help you pull the tegaderm, and then you only want that over the hub. You want to be able to disconnect the tubing if you need to, okay? Sometimes this isn't tight enough, so it'll leak, so this way you can tighten it and you won't mess up the actual IV. Make sure you take the paper off. I've had one too many patients where that is still sitting on there 2 days later. And then your little label is right there, okay? What goes on the label? Date, time, and gauge. You have to have the gauge on there. Most of the colors are universal, but when you get to the bigger ones, it's hard to tell orange from gray, okay? So then, to secure this, because the key for securing, I'm gonna come and I'm gonna pull on that IV. If it comes out with just a little tug, you failed, okay? So you need to practice your securing techniques. There is multiple ones that you can use. Which one you use, I don't care, okay? Military people, we love our chevrons, okay? So if you tear it in half, I never touch the actual stuff, okay? So I just slide it under, and then this gives you a basis to actually put this other piece of tape, which is gonna secure the tubing, okay? So then when I pull, it's not going anywhere. And you don't need a lot of tape to do that. It's just a matter of finding a way to get it to stay, all right? And then you can take this off, loop this around all nice and fancy, and put another piece of tape up here, okay? You wanna be able to access this without having it be a hindrance to the patient. So if you have those patients that are very active, even though they're in the hospital, they're gonna catch it on things. So you wanna try and keep that from happening. If you need to wrap it with Kerlix, that's fine too. You get those patients that pull and tug and everything, wrapping it with Kerlix still allows you to assess it, okay? You don't wanna put anything over the actual insertion site. So no tape under the tegaderm, that's gonna be right over that. If you wanna tape it and put the tegaderm over, but the tape is just down here, that's okay. There's just no tape at the insertion site, okay? And then regarding medications, again, before you do any of this, if you know you're giving a med right away, you wanna have your calculations done, you wanna have it labeled and ready to go, okay? So you're gonna come up and you're gonna do blood, or you're gonna do meds. So then you need to clean your port. Don't uncover your syringe until you're actually ready to do the dosing, okay? So you're gonna come in first with saline, and you're gonna flush and check blood return. You don't have to have blood return for the IV to still be good. It's the flushing without any bulging or infiltration signs, okay? So then you wanna make sure you have your blood return, your clamp is unclamped, and you're going to go, again, you need to time it. So if it's over 2 minutes, know how much you have, and then so how fast you're gonna have to push it, okay? You push your medication. and then you need to flush it afterwards. I usually do 10. Is it different for what?
Flushing?
Yeah.
Well, we have them do 5 because they're using the same flush, right?
Okay, so
Thing
5 to
is-
10.
That little pigtail is just like, it's less than an ml, it's like 0.33 mLs. So, you really can flush
Okay,
with
so the
minimal
biggest thing
amount.
is knowing how much tubing you have, because if you're gonna give it as a secondary, you wanna make sure that you
Yeah.
flush it enough to get all the medication out of the tubing, okay? So then you're flushing, once you get the flush and you know that the medicine is all in, you clamp again, and then you re-secure this however you want, okay? So you're gonna have to do calculations for your IV CPE, okay? Any questions?
So that chevron thing, you want to do it after you do the Tegaderm or before?
I do.
Okay, because at the hospital we need to do it.
And again, as long as there's no tape on the insertion site, I don't care how you guys do it. It's all about securing and keeping that aseptic technique on there.
The
Okay.
principle, according to our